This Medical Minute is brought to you by Avera.
Well, Title IX evened the playing field when it comes to men's and women's sports. But when it comes to on-the-field knee injuries, it is pretty one-sided against the girls.
In tonight's Medical Minute, Jake Iverson explains how doctors are tackling this issue and working to get girls back in the game.
You may recognize Rachel Wilson as the first baseman for the Sioux Falls Impact softball team. What you may not know is that she's been recovering from a nasty injury during the last game of the summer.
I tore my ACL, my MCL, and I shredded my medial and lateral meniscus.
Rachel blew out her knee by simply crossing home plate. Orthopedic surgeon Dr. Erik Peterson says she also crossed the position of no return.
That involves landing with relatively straight knees close together, and not hunched down at the hips.
4 out of every 5 ACL tears are like Rachel's, where they resulted from changing direction or landing wrong, not from physical contact. Ligament repairs are tricky because knee tissue can't heal on its own. Just a few years ago, Rachel's injury would have been a career killer, but advances in arthroscopic surgery will get her back on her feet and back on the field.
The operation done during a typical ACL surgery is to reconstruct or replace the torn anterior cruciate ligament. And that usually involves taking some tissue, borrowing some tissue from another place in the knee. In Rachel's case, it was her hamstring tendons.
Tearing the anterior cruciate ligament is an injury affecting more and more female athletes. This is largely in part due to increased participation in women's sports in the past few years. While the injury can impact both men and women, it's the latter who are tearing their ACLs more often.
Compared with their male counterparts, women are 4 to 6 times more likely to tear their ACL given the similar sport.
Dr. Peterson says some doctors point to the fact that women's knees are just built differently than a man's. Others argue hormones play a role. But at this point, they're all just theories. Rachel is about 3.5 months removed from her surgery. She was initially in protection mode, but now Dr. Peterson is trying to get her ready to get back in the game.
At first, it was like a lot of bending and straightening and making sure my knee would lock. And then it was walking and making sure it was strong enough. And then now I'm up to running. And in a couple weeks, I'll be able to cut and jump and do everything basically that I had been doing before.
Rachel says she's learned a valuable lesson from her injury, that she's not invincible. But thanks to Dr. Peterson, an ACL tear won't end her playing career. Come next season, she'll once again be ready to take the field.
I will, definitely.
With your Avera Medical Minute, I'm Jake Iverson, KSFY News.
Rachel also plays basketball for Sioux Falls O'Gorman and is targeting a return to the court in January. Judging by her rehab so far, she just might be ready by late December. For more information about core orthopedics or ACL surgery, call 877-AT-AVERA or visit KSFY.com and click on health.
And good luck to her. The summit